Asenapine, Wikipedia article audio. Asenapine, sold under the trade names Cifrus and Cycrest among others, is an atypical antipsychotic medication used to treat schizophrenia and acute mania associated with bipolar disorder. It was chemically derived via altering the chemical structure of the tetracyclic antidepressant, mianserin. Medical uses. Schizophrenia. Asenapine has been approved by the FDA for the acute treatment of adults with schizophrenia and acute treatment of manic or mixed episodes associated with bipolar I disorder with or without psychotic features in adults. In Australia, Asenapine's approved indications include the following. In the European Union and the UK, Asenapine is only licensed for use as a treatment for acute mania in bipolar I disorder. Absorbed readily if administered sublingually, Asenapine is poorly absorbed when swallowed. A 6-week, double-blind study was conducted to examine the efficacy and tolerability of Asenapine in acute schizophrenia. Patients were randomly assigned either twice daily 5 mg Asenapine, once daily 3 mg risperidone, or placebo. The PANSS total score for the 174 patients in the Asenapine population was -15.9 at endpoint into a year, versus -10.9 for the risperidone population, and -5.3 with the placebo population. Decreases in PANSS scores became more pronounced 2-3 weeks into treatment with Asenapine. This study conflicts with a 2013 Lancet study that used a meta-analysis of both direct and indirect comparisons of 15 antipsychotic drugs to rate their effectiveness in treating schizophrenia. In the 2013 study, Asenapine was rated as having mild standard effectiveness compared to the high effectiveness demonstrated in the former study. In the 2013 study, it was 13% more effective than luracidone and iloperidone, approximately as effective as ziprasidone and chlorpromazine, and 12 to 16% less effective than haloperidol, quizapine, and aripiprazole. A 2015 systematic review examined the effects of Asenapine for people with schizophrenia. As for its efficacy in the treatment of acute mania, a recent meta-analysis showed that it produces comparatively small improvements in manic symptoms in patients with acute mania and mixed episodes than most other antipsychotic drugs such as risperidone and olanzapine. Dropout rates were also unusually high with Asenapine. According to a post-hoc analysis of 2 3-week clinical trials, it may possess some antidepressant effects in patients with acute mania or mixed episodes. Acute mania. Based on its exceptionally high, unequaled affinity for the 5-HT2A, 5-HT2C, 5-HT6, and 5-HT7 receptors, and very high affinity for the alpha-2 and H1 receptors, Asenapine, given normal tolerability, should theoretically demonstrate among the highest improvements in the negative symptomology of schizophrenia among all current antipsychotics, such as high cognitive improvements and positive, stable mood maintenance. Adverse effect incidence. Note, the discussion below these lists provides some more context into the frequency and severity of these adverse effects. Pharmacodynamics. Very common adverse effects include. Common adverse effects include. Uncommon adverse effects include. Adverse effects. Rare adverse effects include. Pharmacology. Unknown incidence adverse effects. History. Asenapine seems to have a relatively low weight gain liability for an atypical antipsychotic, and according to a recent meta-analysis it produces significantly less weight gain, 0.23, 95% CI, 0.07 to 0.39 then, paliperidone, risperidone, quetiapine, sertindole, chlorpromazine, aloperidone, clozapine, zotapine and olanzapine, and approximately as much as weight gain as aripiprazole, lurasidone, amisulpride, haloperidol, and ziprasidone. Its potential for elevating plasma prolactin levels seems relatively limited too, according to this meta-analysis. This meta-analysis also found that asenapine has approximately the same odds ratio for causing sedation as olanzapine and haloperidol, and a higher odds ratio for sedation than aripiprazole, paliperidone, and amisulpride, to name a few, and is hence a mild-moderately sedating antipsychotic. Being a second-generation antipsychotic, its liability for causing extrapyramidal side effect is comparatively low compared to first-generation antipsychotics such as haloperidol, as is supported by the aforementioned meta-analysis. Asenapine shows high affinity for numerous receptors, including the serotonin 5-HT1A, 5-HT1B, 5-HT2A, 5-HT2B, 5-HT2C, 5-HT5A, 5-HT6, and 5-HT7 receptors, the adrenergic alpha-1, alpha-2A, alpha-2B, and alpha-2C receptors, the dopamine D1, D2, D3, and D4 receptors, and the histamine H1 and H2 receptors. It has much lower affinity for the muscarinic acetylcholine receptors. Asenapine behaves as a partial agonist at the 5-HT1A receptors. At all other targets, asenapine is an antagonist. As of November 2010, asenapine is also in clinical trials at UC Irvine to treat stuttering. It was developed by Schering-Plough after its November 19, 2007 merger with Organon International. Though Phase 3 trials began while Organon was still a part of AkzoNobel. Preliminary data indicate that it has minimal anticholinergic and cardiovascular side effects, as well as minimal weight gain. Over 3,000 people have participated in clinical trials of asenapine, and the FDA approved the manufacturer's NDA in August 2009. Schizophrenia, treatment, for up to 6 months, of an episode of acute mania or mixed episodes associated with bipolar I disorder, maintenance treatment, as monotherapy, of bipolar I disorder. Somnolence, weight gain, increased appetite, extrapyramidal side effects, sedation, dizziness, dysgeusia, oral hypoesthesia, increased alanine aminotransferase, fatigue, hyperglycemia, elevated blood glucose, syncope, seizure, dysarthria, sinus bradycardia, bundle branch block, QTc interval prolongation, sinus tachycardia, orthostatic hypotension, hypotension, swollen tongue, dysphagia, glossidynia, oral paresthesia. Neuroleptic malignant syndrome, tardive dyskinesia, speech disturbance, rhabdomyolysis, angioedema, blood dyscrasias such as agranulocytosis, leukopenia, and neutropenia, accommodation disorder, pulmonary embolism, gynecomastia, galacturo-E. Allergic reaction, restless legs syndrome, nausea, oral mucosal lesions, salivary hypersecretion, hyperprolactinemia.